I'm very fortunate to have Dr. David Nye here with us again today. Welcome.
Thank you.
Dr. Nye is an integrative medical practitioner, and we've had you on the channel before. I'd like to talk to you about a controversy today, cholesterol and the use of statins. So many people are on statins.
It's a crime because really statins have been pushed by the pharmaceutical industry, I believe, to the detriment of most of the patients.
That's a very strong statement.
You
must have a really good reason. Yes, please.
Yeah, I think cholesterol has become such a big bogeyman word. And a lot of the big studies that they've done over the years have been shown in recent writings to be have had their findings interpreted with a bias towards the pharmaceutical industry. And if one goes back and reinterprets that information from those trials, one sees that statins do not really improve life expectancy. And really, why would one take something if you don't want to improve your life expectancy? They're very good at bringing down cholesterol,
right,
but they don't bring down life expectancy. And this is where we need to really relook at the whole cholesterol story. Is it really a myth? Do we really need to worry about high cholesterol, how dangerous it is? And are there safer ways of dealing with it?
I mean, people are so scared. Oh, my cholesterol levels are high. But you need cholesterol.
You do. I mean, cholesterol is made in the liver. Whether you eat fat in the diet or not, the cholesterol has got to be made because it's the building blocks for all the hormones in the body. Most of the structure of the brain is made of cholesterol. So it's a very important substance to have in the body. And a lot of the cholesterol the liver makes is actually used in the body as like a Band-Aid for inflammation.
Right.
So it's often an indication of inflammation in the arteries and elsewhere that you have a high cholesterol.
Right.
So this is where so much has been misinterpreted. In fact, I love to show my patients a picture of a nice clean artery where a high cholesterol will sail through the artery without causing any problems.
Right.
And when you have inflammation, which attacks the lining of the artery, that inflammation then attracts the cholesterol, and that then forms a plaque, which then narrows the artery,
right,
and that can block up and cause a heart attack.
I need to have you back to talk about inflammation, please.
Right. Okay,
right.
We'll talk about that another day. So what happens when they analyze these plaques many years ago, they found a lot of cholesterol in the plaques, and they said, the problem here is too high cholesterol. And actually it's too much inflammation, and the cholesterol is the body's response to try and improve that and try and heal it.
So what is the difference between LDL and HDL, just for our readers?
LDL is often called bad cholesterol, but in fact we now analyze the LDL even further into two subgroups, the ApoA and the ApoB. And ApoA are like large fluffy beach balls, which are good, and ApoB are like small dense marbles, which are bad. So we want to know, and we can analyze this with a simple pathology test, to how much of the A and the B that there is in the body. So, but generally LDL, too much of that is not a good thing. And then the HDL is a very good cholesterol. It's the one that both of them are transporters of cholesterol, and it's the one that we really want to have a high level, as high a level as possible. And the sort of things that are going to give you a high HDL level is a lot of lifestyle factors and having a lot of exercise.
When your cholesterol is high, but you're otherwise healthy, is there something that you would recommend that a person supplements with rather than taking a statin?
There are a lot of natural supplements like red rice yeast and various other things that can help to bring down cholesterol. But again, I think it's far more important to analyze the overall risk to a patient. So we look at other risk factors as well. We look at things like CRP, which is a measurement of inflammation in the arteries. We look at homocysteine, which is another risk.
What does that stand for? Something reactive protein?
C-Reactive protein.
Just C-Reactive protein. C doesn't stand for anything else?
No, not that I know of. And homocysteine is another important risk factor. So we need to look at all these risk factors. We need to look at the breakdown of the cholesterol. Because nothing makes me madder than when a medical aid will ask somebody to have a finger prick total cholesterol, and based on that, they will then judge whether they're poor risk or bad risk. Because there's so much more to it. We need to have a whole breakdown all the different types of cholesterol. And with that information, we can then supplement more appropriately. Things like niacin are very good. Omega-3 fatty acids are very good. These are all things that help depending on the kind of breakdown that one has.
What are the side effects of statins?
This is one of the reasons why I really don't like statins and why many integrative and natural doctors don't like them, is because they have been associated with a lot of side effects. And a lot of them creep up in a patient, so they don't always recognize that it's due to the statin. Things like memory loss, tiredness,
I heard it's
muscle
a precursor
pains.
I heard it's a precursor to dementia, Alzheimer's.
Yes, yeah,
Right.
certainly.
Sorry.
So
Continue.
often people think, it's just old age or stress or whatever. But some very serious side effects can really affect the muscles. I mean, even the muscles can have a condition called rhabdomyolysis, which fortunately is very rare. But certainly the...
what does that look like?
It's basically where the muscles get destroyed.
So it's an atrophy.
Yeah, it's like an atrophy, and it's irreversible. The reason why statins have a lot of side effects is because they interfere with the formation of coenzyme Q10, which is a very important substance in the mitochondria, or the energy houses of each individual cell. And when that CoQ10 is depleted, you end up with muscle pains and tiredness and memory loss and that sort of thing. So if one really has to take a statin, I'll tell you just now why, who I think does need a statin, then one can supplement with coenzyme Q10 to replenish that level, which can minimize the side effects.
So coenzyme Q10 is often used as a supplement to improve the heart function.
It is. It's used in so many instances where one has possibly fatigue or mitochondrial burnout or a weak heart, because the heart has got so many mitochondria per cell, more than any other cell in the body.
Right.
So it has a very great demand for CoQ10, and the brain does as well too.
Oh, that's interesting. How do you wean yourself off, or is that something that you would not recommend people do by themselves?
I think one needs to do it under guidance of a medical doctor. I usually tell people, once I've evaluated their cardiac risks, to stop the statin altogether. You don't need to wean off it.
Right.
And if necessary, to replace with other things.
You need to look at the whole picture, as you say. So you would do a
yeah.
full blood count, you'd look for the CRP and all the other
the whole
markers.
breakdown of all the different types of cholesterol and their lifestyle. So much of it is due to lifestyle. If there's a lot of bad factors in their lifestyle, those need to be corrected far more importantly than taking a medication.
Is there a risk, hereditary component to somebody that's predisposed to a heart condition where they naturally
we have a lot of Afrikaner stock who've got very high cholesterols. And I do believe, again, even though they might have a high total cholesterol, their lifestyle would determine what the breakdown products are like. And you often find somebody who's got a high genetic total cholesterol, but they've got a very good HDL, which mitigates that. They might have a lot of light, fluffy ApoA amongst their LDL, which would mitigate against that. They might have a low homocysteine, which mitigates against that. So just having a high total genetic cholesterol does not necessarily put you at increased risk.
Right. Could that be a reason why very young, active sportsmen sometimes die of a heart attack?
Not because of a genetic high cholesterol. They die because of unrecognized silent inflammation or high homocysteine or the other factors that are. But the biggest causes of heart attacks are stress combined with inflammation.
Right.
So far more important than cholesterol.
That's really
as a risk for heart attacks.
So David, earlier you mentioned that some people would need a statin. Under what circumstances?
Yeah, I think the studies show that somebody who's had a heart attack and has high cholesterol and wants to prevent a second heart attack, they certainly benefit statistically in the studies from being put onto a statin. But people who've never had a heart attack or women in their menopausal years really don't seem to benefit from the statins in the same way.
The side effects just don't.
Side effects are a problem, and the morbidity, the death rate is still high, even if they're on the statins.
Thank you so much. I can't wait to have you back and to talk about inflammation.
You're welcome.